Nicking our finger with a knife, while chopping something for a salad, is just an annoyance for most of us. We have an option to rinse the cut, apply a disinfectant, and perhaps a band-aid, and then keep going on with our lives. Likewise, most of us will just get up and proceed with our lives, after tripping and falling, not giving it any more thought, and hardly spotting the bump that may appear after that. Unluckily, there are individuals whose lives may be in threat due to such apparently minor accidents, the hemophiliacs. Hemophilia was primarily spotted in the 10th century, when physicians noticed that people were bleeding to death after suffering only minor injuries, particularly males. At that time, it was termed as a bulcosis. Sadly, due to the inadequate technology, it was impractical to research the illness, as it should be. Several renowned historic figures are believed to have had hemophilia, notably members of the European royal families. It was every so often treated with aspirin, a blood thinner, causing the symptoms in the hemophiliac to worsen. In 1803, Dr. John Conrad Otto of Philadelphia initiated to research people he called bleeders more comprehensively, acknowledging it to be a hereditary condition that was most often forwarded onto males by their healthy mothers. Hemophilia is an inherited bleeding disorder where the blood does not clot properly. It is caused when blood does not have enough clotting factor, which is a protein in blood that controls bleeding. In 1937, hemophilia was officially divided into two types, A and B. Hemophilia A is also called classical hemophilia. It is the most common form, and is caused by having low levels of factor VIII. Hemophilia B is sometimes called Christmas disease. It is caused by having low levels of factor IX. Bleeding is usually internal. A wide range of bleeding episodes occur due to low levels of clotting factor, usually into the joints or muscles. These may occur suddenly, with no evident root, or as a consequence of trauma or injury. Specialized treatment is vital to help blood clot normally. If internal bleeding is not stopped promptly, with treatment, it will lead to pain and swelling. Over a period of time, bleeding into joints and muscles can result in permanent damage, such as arthritis, chronic pain, and joint damage, needing surgery. Hemophilia affects around 400,000 people globally, several of whom are not entirely concerned of their condition, or are not receiving the treatment they must. As comparatively insignificant percentage of the world's population suffers from hemophilia, many folks are not alarmed just how severe this condition is, and how much more challenging and precarious it makes the lives of those who have it. And this is how World Hemophilia Day comes in. Since 1989, World Hemophilia Day is an international awareness day for hemophilia, von Willebrand disease, and other inherited bleeding disorders. This day was started by the World Federation of Hemophilia, or WFH, which opted 17th of April as the day to bring the society together, in admiration of WFH founder Frank Schnabel's birthday. World Hemophilia Day brings the international bleeding disorders community together. Since COVID-19 pandemic have a foremost impact on people with a bleeding disorder, that intent has never been more important. This April 17th, play your part to adapt change during this unique time, and work hard to help sustain care in a new world.